The Big WECK presents Buffalo on the Rise, sponsored by Doctor Kaplansky Dental Implants. Get new permanent teeth in 24 hours with our exclusive Teeth Now process. Welcome to the television show devoted to local business, Buffalo on the Rise, with your host, Joe Chili. There's an entrepreneurial spirit in Western New York that's putting our area on the cusp of greatness. Each week, Buffalo on the Rise features local business leaders and decision makers who are shaping our future. If it's about local business, we'll talk about it right here, right now, during Buffalo on the Rise.
I'm Joe Chili. On this edition of the Big WECK's Buffalo on the Rise, I'll introduce you to some interesting people from hometown businesses with interesting stories to tell, like William and Yelena Sprague from Buffalo Ballroom, who'll teach you how to dance like the stars. Dr. Milliotto is back with alternative pain relief to help you live a better life, and Dr. Kaplansky returns with affordable dental options to make your smile bright. All on this edition of the Big WECK's Buffalo on the Rise. Stay with us.
Welcome back to Buffalo on the Rise. I'm Joe Chili. Listen to me weekday mornings from 7 to 9 on the Big WECK. Now, if you want to learn how to dance, whether it's for the ballroom, whether a wedding, special event, find out how with our John DeShulo, who's in Orchard Park. John?
Thanks, Joe. John DeShulo with you at the Buffalo Ballroom in Orchard Park. We're going to find out where in just a little bit. But I am with Western New York's premier dance couple, Yelena and William Sprague. Thanks for joining us on Buffalo on the Rise.
Thank you so much. Thank you for coming.
William, tell us about the kinds of folks who come in. We see some dancers behind us now. You offer classes for really anybody of any age.
Yeah, that's true. Anybody of any age and any ability also. So whether you're a beginner or whether you've been dancing for many years, we can match any skill level.
And we should mention you are both world champion dancers. And Yelena, you came to the U.S. from the Ukraine, and you came here to teach dancing. Am I correct?
Yep, all my life, keep dancing all the time. I started from 9 and I keep dancing, never stopped.
That's terrific. And where did you meet?
So we met actually in the studio. Yelena actually was the manager when I started. And then since then we decided to start our own studio, and that's quite a while ago now.
That's terrific. So love and dance has brought William and Yelena together. And I have to ask, what kind of dances do people want to learn here in Western New York?
Most common ballroom like waltz and foxtrot, like classy type of dances, but then something fun like hustle and salsa, very popular now as well. We teach variety of dances. We have a lot of dances in our program.
The hustle is still a thing, Yelena?
Yeah. We apply to any rhythmical song. Even not necessarily it has to be hustle song, but just nice upbeat music, and you can apply steps into the music.
So, William, I guess a lot of people come in because they have a wedding coming up or a special event. And is that a motivator for people to want to come in and learn how to dance?
Oh, yes, definitely. A lot of people are getting married, especially with the season coming up with summertime and the fall. So a lot of people come in several months before their wedding, so that way they can learn a custom choreographed routine, or maybe just learn how to dance in general. And then their wedding day can have the best outcome and have the nice pictures.
Bernadette, how long have you been dancing here at Buffalo Ballroom?
Since October of 2016.
What's it meant to you?
A lot. It's one of my favorite days of the week, if not the favorite day of the week. I've learned self-confidence. I've learned dance moves that I've always wanted to learn but never put myself out there. So now I have, and I enjoy every minute of it.
Giving you a lot of self-confidence.
A lot of self-confidence. I've been to a competition, nerve-wracking, but worth every minute.
So if somebody comes in and they're maybe not that fleet on their feet, that's okay. Everybody's equal and everybody can have a lot of fun.
Oh yes, we start with very basic, step by step, make them feel comfortable, and then everybody looking how far they want to go, because we have almost like no limit really. We have social dancers, we have wedding couples, we have competitor dancers, our students, few of them here who performing in the showcases. So it's like step by step, we all together create new goals.
And I think in addition to the dancers that are some of your clients, you have family here dancing as well.
Oh, yeah, of course. My son actually is over here dancing, and my daughter Sonia here is dancing as well. And they go to competitions and do showcases and performances. So
We have William's sister dancing, and her husband, and nephew, and niece. I don't know, a lot of people love to dance.
So what's it like having a mom and dad who are professional dancers? How has that motivated you to want to learn how to dance?
I've always seen my parents dance, and when I was younger, I was like, oh, I want to be like my mom. And one day, my mom was like, here, you want to try a lesson? And I was like, sure. And then ever since then, for the past 6 years, I've been doing it.
How old are you, Sonia?
12.
Jackson, how old are you?
I'm 8.
What kind of dances do you like to do?
I like to do samba, rumba, and cha-cha.
You're pretty good, huh? What's mom and dad like? They're pretty good too, huh?
Yeah.
Thanks, Jackson and Sonia. And you compete as well. Where have you been competing, William?
So I just actually came back from Miami. We do Pro AM competition where you can dance with your instructor in competition, and you can have choreographed routines. You can just dance closed division where you dance with whatever song they choose to put on. But Yelena and I actually competed also professionally for a number of years, and we actually were national finalists in 2012.
Wow, where was that?
National was in Orlando, right?
Yeah.
Yes, in Orlando, and this is where we found out like I was pregnant with Sonia, and then a little bit harder to commit after when you have a children, but we're still dancing. It's helped us to feel good and keep moving and active, but right now we dance most of the with students.
And you have packages, I understand, too, William. So if somebody wants to come in, they can maybe take 1 lesson, 2 lessons, but explain to the viewer what the packages are all about.
So usually people start off with our introductory. Our introductory is going to be 3 lessons, 2 30-minute private lessons with just 1 instructor, and then 1 45-minute group class. And that only costs $25. And that gives you the opportunity to see if you like it, if you feel that you can learn, and then go from there. After that, we have packages that range from group classes or group classes with private lessons. And that starts from $96 for 1 private lesson a month and unlimited group classes. So you can dance every day.
Dance every day, and it doesn't matter if you have a partner. I don't have a partner, but I can come in and learn to dance, right?
You can dance with me or with our
I could dance with Yelena?
Yes.
Oh my gosh, I think I'm signing up, William. But that's important to know because in addition to the fun of dancing, it's exercise, and I remember you were telling me that you had a client who was up in age, and age should not be a factor, right?
Yeah, my oldest student was 96 years old. I had actually danced her probably 8 or 9 years. She started around...
Even longer, probably.
Yeah, 86. She was 86, so 10 years. Yeah, she danced for, and she did competitions and went all over the country, and really, any age can dance.
What motivated you to learn how to dance? What inspired you in the Ukraine to want to not only dance but also teach?
Actually, to teach, it was a surprise for myself as well. Like, I dance just for fun, like a lot of children, and my friend just brought me to a dance studio, and I kind of stuck for years there. But then when I finished high school, and local studio was talking about lessons, dance lessons, and they invite me to teach, and I'm like, I have no idea how to teach. I never was trained to teach. I mean, maybe very little, but not really much. And then little by little with their training and help, and then I never stopped again. So I keep going and I teach, so I love it.
What motivated you, William, to want to dance?
I mean, my mom pushed me for probably a year before I started, and eventually I was like, okay, all right, I'll give it a try. I'm probably going to be terrible at it, but here goes nothing. So of course I went in, and it was a lot of fun, and I've been dancing ever since.
Well, you're doing terrific. And where are you located so everybody out there knows where Buffalo Ballroom is?
We're actually at 3461 North Benzing Road. We're right at the corner of 219 and Mile Strip in Orchard Park.
Can't miss it, right, Yelena?
No,
Right off
we
the
have big
219.
sign.
Yeah. And you have a special event coming up in April we should mention.
Yes, we're going to have Soli Sambra. We're going to have a very nice Latin band that will be playing here. We're going to have food and refreshments here. It's open to the public, so anybody that would like to stop in and dance and listen to the live music. And there'll also be a professional show and student performances. So everybody, please welcome.
April 18 from 2 to 5.
There you go, and you can find out more at buffaloballroom.com. Back to you, Joe.
Thanks, John. If you'd like to find out more, visit the Buffalo Ballroom at 3461 North Benzing Road in Orchard Park, just off the 219, or give them a call, 716-262-0039, and online at buffaloballroom.com. Sponsorship and promotional consideration for the preceding segment was provided by the Buffalo Ballroom. And don't forget to join all your favorite personalities, JP, Roger Christian, Bobby O, and me with classic oldies from the 60s and 70s on the Big WECK. Hi, I'm Joe Chili, weekday morning, 7 to 9 on Buffalo's oldie station, the Big WECK. Joining us today on Buffalo on the Rise is Dr. Christian Milliotto from Western New York Pain Relief. Doc, how you doing?
Good, how are you?
Good. You're always doing fine. Come on. Come on. You know, your clinic kind of emphasizes non-surgical, non-surgical pain relief, things like this. Can you explain to us, that, when people think one of two things, you're old, we can't do anything about it, or we're going to jump right to surgery, that they should be asking themselves a second question or talking to you about that, right?
Yeah, so I kind of break it down like this to people. So pain is a complex issue, and you have to think about your symptoms. So anybody that's listening right now, if you have pain, think about where it is, and think about how long you've been dealing with it. So if you're somebody who, you've had x-rays or MRIs and you were told that you had disc herniations or bulges or stenosis or sciatica or nerve issues in your hands, legs, or feet. The problem with treatment is a majority of treatments are not targeting the root cause. And this is not the patient's fault. The patient is advocating for themselves. But medicine has evolved immensely, and the rest of the world needs to get on board, including the doctors that you're working with. Many times care ends up going to a pain management facility where they're giving you an injection and not explaining what it's for, or they're sending you to PT and Chiro, and then maybe it fails, and they discharge you and bring you back. You should be asking questions about why you keep doing the same thing. What's the definition of insanity? And in my clinic, we break that cycle. That's what we do. Our therapies are research-based. These things have existed for many, many years. And what I have simply done is I have gotten myself certified and fully invested in treating the most advanced disc and nerve disorders, and we give people their lives back, and we eliminate medications, and we eliminate surgical intervention in a majority of cases. I will always be honest with you about the severity, and we get you back to living your life again.
We've talked many times about regenerative therapies. What exactly does that mean? Well,
regenerative therapy in general is a very broad term. So when people hear regenerative, the first thing they might think of is stem cells. And here's the truth of the matter. Stem cells are something that we've done research on, but if you're dealing with neck or back issues, the research is just not there yet, And a lot of people who are in pain will seek and try almost anything, but it's a very, very expensive procedure with a very large chance that nothing occurs, okay? But when you're using regenerative treatment, there are therapies that can and do have research and FDA approval to deliver that. So for example, we have a specialized class 4 medical laser, and this therapy will target specific disc and nerve conditions, arthritis, inflammation, neuropathy symptoms, cellular damage, and they are designed to actually enhance healing. The Synexus that we use. This is a very, very special machine that delivers what's called cell signaling. We're actually helping your damaged cells that are telling you have pain function again. By getting that nerve cell to turn on and off, you have improvement in quality of life and function, a reduction of nerve pain, but a restoration to that damaged tissue. And the coolest thing about it, it doesn't matter if you're 18 years old or 88 years old. The body has the ability to heal. You need the right and proper treatment, and that's what we do.
All right. New pain relief therapies are being introduced all the time.
Yes.
How do you make a determination if or when you'll incorporate one of them?
So the biggest thing is understanding the patient. When you come in, I will tell you, and I mean it in all honesty, come in for your evaluation. You will learn more from me in an hour consultation than you have probably been told in even up to a decade of working with multiple doctors, because I take a look at everything. So I don't just look at your diagnosis. If you're dealing with nerve issues, I want to know why, I want to know where. If you have arthritis and you have inflammation and it's affecting your body, how is it affecting you? Is one leg not working properly? Have you lost function? Is it in the morning or at night? And when you introduce therapy or treatment, that is going to be customized to you. So depending on what we have to work on, we will implement the proper therapies. And then the biggest thing for me is, what are you taking that's masking your pain? Are you on steroids? Do you have diabetes? Do you have metabolic issues or circulatory problems? Pain medication doesn't treat nerve and disc disorder. It masks symptoms and drugs the brain. So I want to help restore that person's mental state, physical state, and emotional state.
All right, we want to stay away from the term cure.
Correct.
All right. So what would a successful patient outcome be for you?
Pain relief. and that could be complete pain relief. The thing about medicine, and this just applies to everything, you can't use the word cure. Okay, if anybody ever says, I guarantee, I can cure, I can do this, your surgeon doesn't say that, your primary doesn't say that, nobody says that, because medicine's not perfect. It's called practicing medicine. But when you treat a person, if you deliver the proper care, I will tell you, I have had people that have come into my office and they've walked out and told me I feel 100% pain-free. Does that mean your diagnosis on your medical data will ever change? Maybe not. But it doesn't mean that a person has to have pain, you know. When you're talking about nerve damage, I had a patient that I treated, Ernesto, great guy. I wrote him up a treatment plan for 20 treatments based on the clinical research for the nerve damage in his feet. In 12 visits, he looked at me and said, my numbness is completely gone, I'm 100% healed. What do I say to that? Okay, will I say I cured something? No, absolutely not. I am going to be honest and upfront with a patient, but that doesn't mean curing doesn't have to mean that the symptoms are gone. Okay, curing is something when you're talking about cancer or certain types of things where even then that goes into a latent stage. When cancer goes away and it's cured, they always check to make sure it doesn't come back. And medicine is designed to help people improve quality of life and function, but the biggest thing I've seen is when people are dealing with disc and nerve issues or problems with their bones and joints, they're not getting treatment to treat them. They're getting things to manage them, and I want to change that for you.
Dr. Christian Milliotto, thank you very much. We appreciate that. For more information and answers to your questions, contact Western New York Pain Relief by calling 716-650-PAIN or go to buffalopainrelief.com. Sponsorship and promotional consideration for the preceding segment was provided by Western New York Pain Relief. And don't forget to join all your favorite personalities, JP, Roger, Christian, Bobby O, and me, with classic oldies from the 60s and 70s on the Big WECK. I'm Joe Chile. You can listen to me mornings on the Big WECK. Joining us today on the Big WECK's Buffalo on the Rise is Dr. Kaplansky, and I want to welcome you to the show today. I'm impressed by some of the things I see about you. You know, we do background, obviously, before we do a program like this. So I wanted to look up some things about you. First off, you started in business with a friend of mine in Niagara Falls, which was a while ago, but all of your certifications and things like this, you'll have to explain some of these things to me. Because if I look up dentists in general, I see a couple of things. Graduated from here, did work here, or whatever. But you're board certified in implant dentistry, diplomat of the American Board of Oral Implantology, fellow at the American Academy of Implant Dentistry, fellow International Congress of Oral Implantologists, fellow Academy of Dentistry, certified Zaga Center, which is kind of like a mystery to me. We'll have to ask you about that. But what do all these things mean? To me, this means that all dentists are not the same, right? I mean, but when you start looking at all these things, how long did it take to get these? And was it something that you planned originally, or did you say, these are the things I'm going to go for as far as certifications?
Well, first of all, I'd like to thank you for inviting me
to
the program. It's my pleasure to be here with you. It's a lifelong journey, really. This obviously took years to accomplish. And unfortunately, that's what we see often now in practice, is many younger dentists just fresh out of residency are doing these procedures, and they probably don't have enough experience yet to perform them.
When you start talking about things, and you start talking about implants, because it's something specifically that you do, is there something that they teach you in dental school with regard to implants? You know, something that all dentists do. And how did you move past that to come up with your own teeth now method?
Absolutely. So in dental school, you get some really basic rudimentary kind of education on all aspects of dentistry, on all the different procedures. So they can't really focus on anything too in-depth. And then after you graduate, that's when you expand your knowledge, then you kind of go more into the areas of your interest. So my area of interest was dental implants, and I really wanted to get much deeper knowledge in that area. That's how it all happened.
Dental implants, and I have a very basic knowledge of these things, so I'm going to ask you, but you know, you start thinking about things like bone grafts and the prep work that goes into this, and it sounds very invasive to me. And as just a normal individual, I like to avoid pain.
Absolutely, yeah. We all do.
So, I mean, you probably look the same way. You probably looked at this and said, there's got to be a better way to do this procedure.
True. So traditionally, dental implants, dental implants aren't new. So they've been placed routinely for probably about 30 years now, with a lot of data, a lot of research, and it's backed up by science. Now, traditionally, the thinking in dentistry was that you have to prep the site first. So if the site or the bone in the area is deficient, you have to build it up. And how do you build it? By grafting bone, either from a donor or from animals. You would take the bone, graft it in the area, and then grow the bone, then place the implant. So that basically means multiple procedures, multiple surgeries, a lot of time and healing, discomfort, obviously, and patients, had a very, very long journey for absolutely no reason. So what we did, again, based on the current research and the modern science, is we changed the tactic a little bit. So we looked for solid native bone instead of using grafted bone that, unfortunately, a lot of times later turns into mush, and it's not even usable. We use patient's native bone, which is stronger usually, doesn't require additional surgeries, and gives us better and faster results.
Is it a long, involved process?
The Teeth Now procedure that we kind of created is very streamlined. You literally, in 24 hours, you take patients from either no teeth or decayed, non-restorable teeth to permanent teeth, 24 hours.
Is it something that lasts the entire life, your entire life?
It can. It depends on a lot of factors. Most, again, scientific research shows us longevity of dental implants anywhere from 15 to 25 and more years. But a lot of it depends on patients' general health, which can change throughout their lifetime, and also on the maintenance, on care and maintenance. So we do insist that patients come back for routine hygiene so we can check things and clean things.
Are you trying to tell me that people don't generally take care of their teeth?
Sometimes they do.
Flossing is a big thing. You're trying to keep your teeth. I think that this is fascinating in itself. I think the fact that it's less invasive, your procedure, is a big thing. Not just, for myself. I mean, I hate to sound like, oh my, I don't want to have to go through this. But, I had parents and grandparents that went through dentures, and many, many different kinds of dentures, and dentures that didn't seat right, and dentures that were constantly slipping, or whatever the case may be. So
we see it very common. It's a very common experience. Patients really hate their removable appliances. So I'm yet to see a patient who is happy with their denture. So that was another push in creating a process that would give people permanent teeth. So the teeth that they wouldn't have to remove every day to clean. Teeth that wouldn't hurt them when they chew, teeth that wouldn't fall out when they laugh. That's what we did.
So if you hate your removable, appliance, you'd want to give Dr. Kaplansky a call. Dentistry by Dr. Kaplansky, 8038 Rochester Road in Gasport. Phone number 716-772-7500. drkaplansky.com is the website, drkaplansky.com.
Sponsorship and promotional consideration for the preceding segment was provided by the following. Thanks for watching this edition of the Big WECK Presents Buffalo on the Rise. For information on this and other shows, go to our website, bigweck.com, and find out how you can participate on the program if you're a hometown business. I'm Joe Chili. Thanks for watching and listening to the Big WECK, Buffalo's oldie station.
The Big WECK presents Buffalo on the Rise was sponsored by Doctor Kaplansky Dental Implants. Get new permanent teeth in 24 hours with our exclusive Teeth Now process.